Welcome to the Rogers Kakasungura YouTube channel. I don't know if those who have the voice to speak really understand the danger that is facing us. I don't know if those in government are really aware on what they are playing with. We are playing with fire. Tumejimwagia petroli na tunaendelea kuzunguka tu, tunacheza hapo karibu na the flames of fire without taking the risk assessment. The problem with the leaders we elected, they value money than the life of other citizens. Na unajua kitu hawa wajui, God works in a very different way. When COVID-19 came, it did not differentiate between a mama mboga and a dynasty. COVID came and hit all of us at equal level, in equal capacity, without saying this is the president, without saying this is who. COVID came and all of us, including the president, we had to wear masks. Ladies and gentlemen, we are playing around with fire. Some leaders in power might think they are selling Kenyans, but God turns around things and you hear news that whatever they want to push to us has killed them first. God forbid. Ikitu mnaturushia hapa inaweza waua nyinyi wa kwanza ndio we survive. Mnaweza fikiria mnatesa wa Kenya hapa, mpate nyinyi ndio mnaenda. Especially yu muungwana wetu ambaye anakimbia kila mahali kwa ndege, wapi yako libeli yako, wapi yako. Ndugu, wacha kucheza na Mungu. Jana nilisikia mkisema kwamba kama Mungu ameamua hakuna mtu stop playing with. Kenya is a godly country. Mungu alitusaidia COVID-19. We successfully got out of that. And Kenya didn't collapse. Not even our economy collapsed. Tulichiwachilia tu kwa mikono ya Mungu tukasema Mungu kama umeamua wewe tumalize. Lakini kama umeamua tena, tafadhali tuko kwa mikono yako tuokoe. And God saved us. Imagine a time when we were just locked in the house. Hauendi kwa duka, hauendi sokoni, hauendi kanisani, hauendi hospitalini. You are just in the house and we survived COVID-19. Listen, politicians. Listen. I want to send this message to all Kenyans and politicians. I was researching and I went back to 2014, between 2014 and 2016, when there was an Ebola outbreak in West Africa. One of the most deadliest pandemic in Kenya, in the world's history. Wale mnasoma historia, maybe you might have a clue. I want to give you an overview of what happened, especially in, I don't know how you pronounce it. It depends how, is it Liberia, and Guinea. I want to tell you what happened in those two countries so that you have a grasp on what you are dealing with. So that you have a grasp on what you are joking with. Listen, Kenyans. The health workers were at the center of this pandemic. And according to history, the health workers were kizungu wa. Niseme tu in a simple language. the health workers were the most affected one. Doctors, nurses, laboratory staff, ambulance drivers, cleaners, and community health workers were at risk of being exposed to Ebola. What happened then? According to the information and data that is available from the World Health Organization, it says health workers in Guinea, Liberia, and Sierra Leone were 21 to 32 times more likely to be infected than other adults. And about 2/3 of the health workers died. You don't know what you're joking with, Kenyans. Hamujui? Kama kuna wakati tunafaa kusimama tutetee nchi yetu ni sa. Even if it means take William Ruto home now, we do it. Ama William Ruto, niliona Peter Salasia akiuliza ama William Ruto amekuwa of unsound mind na hatujui, amekuwa incapacitated and we are not aware. Members of Parliament, listen. Many hospitals in West Africa lacked, number one, protective equipment, the PPE, isolation wards, running water, training in infection prevention. And according to information, some nurses were forced to use improvised PPEs, including they used plastic bags and raincoats in the early months of the outbreak. And according to information, there was collapse of trust between the citizens and the health workers because most of them thought that Ebola was a government conspiracy, hospitals were killing patients, and foreign responders brought the disease. Just like it is happening now in Kenya. Now listen, ladies and gentlemen. Health workers were insulted. They were chased away. Others could not even manage. But shockingly enough, according to the information here, I want to give you accurate data so that you know what you are joking with. Let me give you a breakdown of the data. Nataka nikupatie data ya Liberia because it was one of the most affected. Total cases 10,675 including suspected. Total deaths 4,809 lives were lost. Among this, nataka usikize. Among this 211 medical workers died from the disease. 211 medical workers died. How many medical workers do we have in Kenya? If Kenya decides to lose 211 today, tuseme madaktari 211 wamekufa, where will Kenya remain? Kenya itabaki wapi? Ndugu zangu, in all this, America didn't even help. America ilituita shithole. They ran away from Africa. They said we cannot involve ourselves because if we do, we might bring this pandemic back to America. So they kept away. Mnakumbuka tukiitwa shithole? You remember? Lakini, in all this, some scavengers and the greedy leaders are forgotten. And they want now to import Ebola to Kenya. Do you know what you are playing with, gentlemen? Unajua kweli nini mnachezea? Do you know what you are playing with? Does Kenya has enough medical workers? Do we even have? Walk to Kenyatta National Hospital. Walk to level 5 hospitals across our country. Ndugu zangu wa Kenya, there are no beds. There are no drugs. There are not enough doctors. Do you know, like for example, in the entire Gusii region, we have one orthopedic doctor mwenye anatibu Kisii, anatibu Nyamira, anatibu mpaka Moi Teaching and Referral Hospital. Kenyans, unless akili yetu tuna. So mimi naomba wa Kenya, if we need to stand firm and defend our country, the time is now. If we lose this opportunity, we will die. By the way, has Kenya done risk assessment? Imefanya public participation? Do we have enough PPEs? Are we prepared for the outbreak? Are we ready for it? Are we ready for it? Why can't we read from history? I feel like blasting. God bless you. Asanteni sana. Thank you.